We're really thrilled that you're here. My name is Jean Carfora, and I'm part of the planning committee for the Diversity Action Team. And as you know, the title for tonight's program is, Ron?
Working Together, when COVID-19 and racial disparities meet.
Great, great. And we had a wonderful graphic that shows the puzzle pieces for our efforts of working together and how we individually make an important statement, and together we can be even more powerful. So we'll be sharing some ideas tonight. Ron, would you show the, there we go.
Okay, there we are. Okay. So,
Okay. All right, and all the puzzle pieces are there.
all right. So let's see. We have a raised hand here. Let me see if I can see the situation here. Yes. So Jennifer, are you still having problems connecting to the audio?
Somebody's crawling in.
Let's give a couple more minutes before we really launch into things, just to let people come in and see if they can sort audio issues.
Ron, when you present the slides, would you click on the present up in the right-hand corner?
Sure.
So that it's a full screen?
I will indeed.
Okay.
Okay. Okay. And I will share that.
Got some new faces.
Wiggle your cursor for a minute. See if this
Really nice.
I'm Santo Calfora.
Are you?
You don't look like Santo Carfora. Thank goodness. Lucky you. He's good.
Okay. All right. Billy Bob, I'll talk to you about that later. Okay, Ron, let's go ahead and start.
Absolutely.
Okay, and yes, these are the 6 organizations that are working together this year to present relevant and meaningful, very diverse topics. And so you can find that schedule on our Diversity Action Team of Rock County if you want to check our Facebook there, and our website. So as you can see, Community Action, Hedberg, NAACP, UW-Madison Division of Extension, Rock County, and the YWCA. And our mission statements are all very similar in that we're very concerned, very caring about the individual and the community, how it comes together to reinforce each other.
All right.
Okay. Next slide.
Yep.
All right. I don't know about you all, but this whole Zoom idea is pretty darn crazy. And I've had a lot of help to get to this point, so bear with me. I don't know how many of you are comfortable with Zoom yet, but we'll give it a try. We want you all to be aware that our program will be recorded, and that will be ready to go by Hedberg Public Library probably next week. They'll have it in Zoom. I'd like for you to mute yourselves, and then after the presentation of our 3 organizations, after each one of the presentations, we'll have questions, so you can either write in chat or you can verbalize your question. So we'll have a chance to discuss immediately following each one of the organizations. That takes care of number 3, and then number 4, as far as the parking lot. we've tried this with Courageous Conversations, and it seems to be working really well. And what that does is from the end of the program, around 7:30 tonight until about 8, we'll have a chance to visit if you choose to for about a half an hour. You will not be recorded during this time, so you can share your comments, your thoughts, your actions, your desires, your efforts, whatever. And we'll also be sharing different opportunities at that time too.
Okay. Thank you so much, Jean. So I'd also like to start before we sort of dive in with a couple of introductions. So Jean, everyone more or less knows you, but just for the sake of decorum, maybe give a little bit of an introduction about who you are.
Oh, Ron, that's a surprise. Okay. I'm Jean Carfora. Santo and I have lived in Janesville for 50 years now, and we love the community. We see a lot of wonderful things going on in the community, working with the Diversity Action Team, and so many marvelous individuals. So I'm very passionate about wanting to make a difference as far as equity is concerned.
Okay, thank you. And for those of you who don't know me, which I imagine most of you don't, my name is Ron Watson, and I am an associate professor of political science and health and society, which is our public health program at Beloit College in Beloit, Wisconsin. And I will be moderating this conversation today and commenting here and there as well, and looking forward to seeing your questions. And especially looking forward to that parking lot section so we can have some more in-depth conversations about these issues. One of the reasons I'm here is because my fields of expertise include, of course, racial and ethnic politics in the United States, as well as health and health policy. I've also, since spring, been involved with one of my colleagues, Rachel Bergstrom, who is an associate professor of biology at the college, in offering what we call the Let's Talk Coronavirus series. And this was a series that was of web-based and eventually sort of Facebook Live-based discussions about the coronavirus from a variety of different perspectives, social, economic, philosophical, and so forth. So that's one of the reasons why I'm here for this conversation. So without further ado, shall we dive right in?
Yes.
All right, so our first guest tonight is Nick Zupan from the Rock County Health Department. And Nick will give you a little bit more of an in-depth introduction to who he is and talk a bit about his work and other issues with respect to the health department. So Nick, please jump right on in.
Sure, thanks, Ron. So I'm gonna pull up my screen here. And if someone could just give me a thumbs up when it's showing up there.
Good, it's there.
Good, okay. So as Ron said, I'm the epidemiologist with the Rock County Public Health Department. Basically, my job is to keep a keen eye on the data with relation to a lot of different health topics. For the last 6 months, I've almost been 100% devoted to looking at COVID-19 and looking at the trends and all of those different kinds of things that are going on, how we can prevent the spread of the illness, how we can see who's more impacted or less impacted by the virus, and what we can do to address some of the disparities that have come up. So I'm here tonight mostly just to go over some overview data of what we're seeing so far in the last 6 months related to who has COVID and where the disparities are. And I'm hoping to learn kind of a little bit more about why some of these disparities exist and where they're coming from and what we can do about them from this group. So I'm going to jump right into the data, and I have just two groups to talk about tonight. The first group I want to talk about is our Hispanic Latino community in Rock County. And so I'm just going to go through some of the data that we know about. We've tested over 2,500 individuals from the Hispanic Latino community. 492 of them have come back positive, about 2,000 being negative, and this gives us a 19% positivity rate. So this basically means of those who have tested, how many test positive. And this gives us a sense of how severe the spread of the illness may be in a group of people. So I have the Rock County rate in parentheses there. You can see that there's already a disparity when we start looking at just these high level data. And you can see that, the Rock County overall percentage is 5.9%, whereas the Hispanic Latino number is 19%. So that's, almost 4 times as much as the general population. So we're seeing kind of a disparity. Another thing that I look at as an epidemiologist is kind of the timeline of when we might see spikes in certain populations. So I've included the graph of the timeline of when we've seen the highest number of weekly cases among Hispanic Latino people in Rock County. One spike that I will point out is in late April, early May. And what happened in this situation was there was a large workplace outbreak at the Birdseye Food Processing Facility in Walworth County. And a large number of Rock County residents actually work at that facility. And that facility does employ a high number of Hispanic Latino people. And so our cases were driven by occupational setting and the workers who work in that setting. Another way that I like to look at the data is just to get a sense of, is the dispersion of the COVID cases in our community proportional to kind of the divisions within our community when we look at our census data. So when I looked at the census data, about 9.1% of our population is Hispanic Latino. Unfortunately, 28% of our COVID-19 cases throughout this pandemic are represented by the Hispanic Latino people. So you can see, again, just illustrating some disparities where we would expect if the Rock County population is 9.1% Hispanic Latino, we would expect if the virus, was equally dispersed, we would see 9.1% of our cases being represented by that group. Unfortunately, due to a number of different factors, we're seeing higher rates among the Hispanic people in our community. One other way that I can look at the data is to see how severely people are ill within a certain group. Fortunately, the Hispanic Latino population, the percent who have been hospitalized with COVID-19 is lower than our general population. And that says to me that perhaps there are individuals who are less severe who are getting COVID-19 in the Hispanic Latino population. The flip side to that is there are questions raised about whether or not there's adequate access to healthcare for Hispanic Latino residents in Rock County. If we take this one step further, we can look at the percent of Hispanic Latino people who have needed intensive care, who have had COVID-19. It's about very close to the general population. So 1.63% of our Hispanic Latino people who have come down with COVID-19 have needed intensive care, and 1.72% of our non-Hispanic Latino population have needed intensive care. The final statistic that I look at when I'm trying to look at some of the disparities is our mortality rate. So how many people who have had COVID have died from the illness? When we look at our Hispanic Latino mortality rate, it's 1.42%. And when we look at our non-Hispanic Latino mortality rate, it is 1.72. Not vastly different. That indicates that there are not major disparities in how severe people are getting this illness, but when we think about the dispersion of the cases, that's where we're really seeing our disparities. I want to shift gears and talk about the same information, but focusing in on our Black or African American community in Rock County. So we have tested just over 2,000 individuals, and 176 have tested positive for COVID-19, about 1,800, 1,850 negative results. So that gives us a positivity rate of 8.6%. And remember, the general Rock County positivity rate is 5.9%. So again, We would hope that it would be 5.9% for any group, regardless of race or ethnicity. Unfortunately, we know that there are disparities in our community, and this is played out in COVID as in several other communicable and chronic diseases in Rock County. Again, I've included the timeline of when we've seen some of our peaks in terms of the number of cases among our African American community. And what I would say here is actually these trends that you're seeing in the graph here are correlate pretty closely to the general population and the number of cases that we've seen over time by week when we look at the whole population. Again, I wanted to look at the census information to see what percent of Rock County's population is Black or African American, and compare that to what percent of our COVID-19 cases are Black or African American. And we can see that 5.3% of our population is Black or African American, but 10.6% of our COVID-19 cases reside in this population. Again, just illustrating that we definitely are seeing disparities in who's coming down with the illness. The other interesting fact that I would point out is that almost 1 in 10 Black or African American people who have been tested for COVID-19 were positive, while 1 in 20 white people who have been tested were positive. So again, this gets back to our positivity rate and illustrates that more or a higher proportion of our population of Black or African American individuals are testing positive, and what are some of the drivers of that disparity. When we break down the data and the hospitalizations among Black or African American individuals in Rock County, we're seeing that 14.2% are hospitalized, and this is greater than, not quite double, but it's approaching double. So here we're seeing that there is much higher severity of illness among the Black or African American community. We have seen this nationwide where our disparities are playing out. COVID-19 is an illness that attacks multiple systems in the body, and those who have chronic conditions or pre-existing conditions such as diabetes or obesity are more severely affected by the illness. When we look at the percent needing intensive care, 1.7% of our cases among the Black or African American residents need intensive care, compared to 1.5 who are not Black or African American. And when we look at our mortality rate, 1.14% of those individuals who are Black or African American have died from COVID-19 who were diagnosed. And when we compare that to the general population or those who are not Black or African American, it's 1.44%. So a slightly lower mortality rate there. So we have more information on our Rock County Public Health Department website. I've included the URL on the screen. We have a disparities report that we update weekly, and we ask that folks can check that out. And I just wanted to provide the data overview and some of the disparities that I'm seeing from my end from the data. And I'm hoping to learn more about the perspectives from other presenters on kind of what's driving some of those disparities and what we can do about that. So I'll turn it back over to you, Ron.
Thank you so much, Nick. So at this time, we'd like to take a few moments to field some of your questions. This is obviously extremely important start as we see the disparities and how they're playing out in people's lives versus the actual demographic reality of Rock County. So let's take a couple minutes. If you have some questions, a question you'd like to put in the chat, please do.
Okay.
And if you have a question, does everyone know how to do the hand raise function? No, I say no. Well, since you're already on screen, sorry, what's your name? Go ahead.
My name?
Sherry Blakely.
Sherry Blakely. Hi, I'm with the Beloit NAACP, and I'm on Beloit City Council. I wanted to ask Mr. Zupan a very quick question about how the statistics are gathered. Are all testing sites required to report to their local city government and then those statistics go to the county? Or how do they come to you at the county?
Yeah, that's a good question. So
Thank you.
how we get the information is when a person is tested for COVID-19, their lab results are entered.
Oh, we may have had a drop here. Can other people still hear me? Okay, okay. So Nick it looks as though Nick may have dropped. That does occasionally happen. So so why don't we just hold on for just a moment to see if he can reconnect. And if not, then we'll go to another question. We'll see if I can answer any of that, since I also sort of have been knee deep in this COVID world for since March. Okay. So we have a question here from Jennifer. So I'll go ahead and jump into that. So why do you think these disparities have happened? I think this is one of the most important questions here, right? Because we're trying to understand why this is happening, and what we think is that on the one hand, there is the disproportionate representation of Black and Latinx or Latino Hispanic individuals among the so-called essential workers, right? And that just, especially during the height of the pandemic, that really led to a greater level and frequency of possible exposure. We think that that's a large part of it. We also think that there are some other factors that could be at play that include close family ties, interestingly enough. And it looks like Nick is just about to come back in, so let me admit him. But we think that that also may play a role here. I know from my own family, I come from a very close-knit family in Virginia, and you know, the idea that they wouldn't get together on Sunday is a thing that they just can't part with, right? And so I think that that's another important part of this. Before we even sort of consider any of the other sorts of comorbidities and sort of illnesses that also disproportionately impact those communities. So no problem, Nick. Are you still with us? Are you back with us?
I'm back. I'm hoping I
Right
don't
on.
get kicked off again. My internet just died right in the middle of a response.
Absolutely. So this is the crazy and nutty world of online everything that we're doing now. So not a problem at all. So do you want to jump back in on that response, Nick?
Yeah, I'm sorry, I don't know where I got cut off, but
No,
basically,
go ahead.
when someone tests positive with their provider, that information is sent to the state. The state sends it in an electronic disease surveillance system to the health department, and then I gather that data. And it's, you know, the demographic information, the race, ethnicity, that's based on whether the patient wants to share that information with their provider. But if they do, that will be included with their positive result, and that's how I'm pulling the information.
So, Nick, we have another interesting question here from Susan Johnson, and they're asking here, I have a question regarding the slides on need for intensive care. Did everyone who needed intensive care receive it, regardless of whether or not they have health insurance? So I think that's maybe the first part of that question.
That's a really important question. Unfortunately, my data does not speak to that issue, whether people who need the intensive care are actually getting it. In most cases, when a patient is hospitalized for COVID-19, the providers will decide whether or not that patient requires intensive care, like a ventilator or something like that. In those cases, if they're already hospitalized, they're probably going to get that care as long as there's space, and our hospital systems have affirmed to us that there is definitely space and things like that in their intensive care unit. The question that I have is how many people out there are very sick with COVID and feel like they don't want to see their provider, or they don't want to go in for healthcare because they're they feel like they don't have the insurance to cover it, or they're not aware of the resources, or any number of things. So that's an excellent question. Unfortunately, we just don't have the data right now to answer that.
Yeah, I mean, I think I would corroborate that as well. And there was a second part to that question, which was, were there many Blacks or Latinos who tested positive who did not receive the care they needed? And my guess is the answer is the same. It's very difficult to know those data, right?
Yeah, that's not included in our data set. I would imagine that there are individuals out there who are hesitant to seek healthcare because of some of the challenges that they face. And I think that's a very important challenge that we need to address in terms of improving access to care.
All right. I think this is Rubina is asking a question. So may I ask if we are looking at viewing the details of the local data? And I assume you mean to really get down into a sort of qualitative look at the individuals who contracted COVID and then what happened with them. Is that within your purview as an epidemiologist at the health department, Nick?
Yeah, that's part of my role and the role of our whole health department team who's doing some of the disease surveillance is looking at, you know, the whole patient story and trying to understand, you know, where they might be coming from or getting the illness from, what kind of healthcare they sought, what kind of treatments they received, and trying to understand how the virus is spreading and trying to prevent that spread to their families and their community members. So, you know, when we talk about data, there's a high level look where, you know, I'm looking more at the general data set of all people who have contracted the illness. There's also individual level data that we're looking at, where people are living, if they're living in certain households or in places that they might be at higher risk or higher risk of exposing others. All those kinds of things are considered, and by and large, our public health nursing team works directly with the individuals who contract the illness to try to educate them and also make sure that the spread is contained and, you know, protect our community basically.
All right. Thank you so much, Nick. With that, we're going to return to our program, and we really appreciate all the information that you brought to us here on this one, Nick. Thank you so much. I'm going to go back to my handy dandy share screen again. And so we're going to move forward to our next guest. And our next guest is Gina Isunsa. And Gina will talk to us a little bit. And Gina, you may have some slides of your own, I think, that you may want to share. Will talk to us a little bit about the YWCA efforts, particularly with respect to immigration outreach. So Gina, are you there?
Yes, I'm here. Hello.
Okay. Hi. Do you want to share your screen?
Actually, we're going to start with the interview, and I think Amy has that interview. I don't know if you have it ready, Amy.
Go ahead and pull that up.
Thank you.
Let's see if we still got some. We don't have any sound, so let's. One of the things we can do, I think, maybe with the share. I think there's a box down in the left-hand corner when you share, so you can stop sharing for a second.
¿Cómo se vio usted afectado durante esta pandemia?
Here.
Can you hear?
Yeah.
No.
I think looks like the video may have frozen a little bit. Has it frozen on your end as well, Jean?
Pardon?
Is the video frozen on your end?
Las bajas es porque nosotros no calificamos para para más recursos de ¿no? Y esa es la desventaja que nosotros los indocumentados tenemos.
The disadvantage I have had is as an undocumented person, and as being undocumented, we don't qualify for some of the government programs and resources that have been available.
¿Cómo se enteró usted de los recursos en la comunidad para la comunidad inmigrante? How did you find out about the resources available for the immigrant community?
Yo estoy cerca de la oficina de YWCA porque tiempo atrás me han ayudado de otras maneras y esta vez yo busqué ayuda con la oficina y gracias a las personas y a todos los que trabajan en White, mucha ayuda como algunas tarjetas, como más recursos y eso es demasiada ayuda para los que no podemos recibir nada más fuera, como oficinas de gobierno. Nosotros no podemos pedir nada, pero como YWCA ellos tratan de ayudarnos en todo lo que se puede.
Okay. Y tal vez voy a tener que pedirle repetir unas cosas en esta parte porque había mucho. So I may have to ask her to repeat some of that because there was a lot. I live close to the YWCA, and in the past, they have helped me with other personal situations. This time, I went and asked for help, and everyone at the YWCA has been very helpful. I have received cards, gift cards for things to help out, and this is really helpful because we aren't able to get any of the other resources that are offered by the government. ¿Falté algo? Did I forget anything?
I don't think so. No creo. ¿Qué tipo de ayuda ha recibido hasta ahora? ¿Y por parte de qué agencias? What kind of help have you received so far and from which agencies?
Agencias, solamente he pedido ayuda a la oficina de YWCA y me he acercado a Army Salvation para pedir comida, pero la ayuda más grande que he tenido ha sido de oficina de YWCA, porque las tarjetas que yo recibo puedo ayudarme en comprar las cosas que no las puedo obtener nada más así. La gasolina del carro es necesaria y como otras cosas de la casa. Eso es lo que a mí me ha ayudado la oficina de YWCA.
Okay. The only agencies that I have worked with have been the YWCA, and also I went to Salvation Army to get help with food, but the biggest help has come from the YWCA and the gift cards that I have received, because they have helped me with gas, which is really important for my car to do things, and also with buying other household supplies that I am not able to get by other means. And so the help I've received from the YWCA has been very important.
Quiero mencionar también quiero mencionar que estos últimos meses ya estuve muy afectada con retrasos de pagos y necesitaba el cubrir la renta. Estaba preocupada por la renta y la oficina de YWCA me apoyó con eso. Hice la aplicación y me ayudaron para hacer el pago de la renta.
Okay, I also want to mention that these last few months I have been worried because of getting behind on payments. For example, I've been worried about my rent payment, and the YWCA has also been able to help cover my rent payment.
También quiero mencionar que sigo esperando respuestas sobre mi estatus legal y la oficina de YWCA se encarga también de migración y ellos me han podido ayudar con un abogado y mi caso está pendiente y gracias a la oficina también he podido recibir ayuda sobre eso.
I also want to mention that I am waiting to find out about my status in the United States, and the YWCA office is helping with that as well, as far as an attorney, and helping me in that process also because they do cover immigration also.
Ya no tengo más preguntas. ¿Hay algo más que quisiera compartir con nosotros?
This is Renee. We intentionally stopped the video there because otherwise it would go too long. Gina will be jumping on right now to talk a little bit more about that.
Right. All right, Gina, go right ahead.
Okay, so during the interview, I asked her questions like how she was affected during this pandemic, and she's a single mom who doesn't qualify for the CARES Act help. So even though she was working, her hours were cut down to 20 hours per week. She doesn't qualify for any other help right now because she's in with her immigration process. We did connect her with immigration attorneys who are looking at her case. She's still waiting on her work permit. We were able to help her with food and gas cards too, and with the GoFundMe page that we have with the Immigrant COVID-19 Relief Fund, we were able to help her with her rent too recently. So basically, she was telling the disadvantage of being an immigrant in the community and talking about how she was affected being a single mom of two and working less hours, and the help she got from other agencies too. With the GoFundMe page, what we did is one group from Janesville, one from Beloit got together and started the conversation on how can we help the immigrant community. So they came up with the idea of the GoFundMe. They approached the YWCA, specifically the Immigrant Outreach Program. So the GoFundMe was created to help the underserved members of the immigrant community. And I want to clarify here that when we say immigrant community, we're not only talking about the Latinos, we're talking also, we've been working with people from the Hmong community. We have clients who are currently working with the immigration attorney from Russia, Morocco. So we're not only working with the Latino community. So when we talk about the immigrant community, let's be inclusive with other communities too. So far, we've been able to help 76 families with food and gas cards. And we're also working with the collaboration of the Faith Lutheran Church. So do you have any questions for me regarding the GoFundMe or the service we are currently providing?
So, yeah, go ahead.
This is Santo, not Billy Bob, but Santo. Would you mind sharing with the group information about the Immigrant Support Network?
So we recently changed our name. It was called Immigrant Task Force. So right now we're the Immigrant Support Network. We are working on our mission and vision statements. I don't have that right now with me, but it's basically groups that have come together to help the immigrant community, to connect them to resources available in the community. I will share the link to the GoFundMe. We do have that available on our webpage on YWCA Rock County and also on the Facebook page. This collaboration with the groups, it's also been, we have people from Faith Lutheran Church and other churches who come together to work with us and help collect money to, there's the link for the GoFundMe page already there. Thank you, Renee. And help, basically our intent is to help the immigrant community, to connect them with resources that we have. And with this GoFundMe, we're able to help them with rent assistance, food, and gas cards too.
Thank you, Gina.
All right. Any other questions for Gina? Here, this is some extraordinarily important work. And Renee,
also, I would like to add that all total between what has been raised by Faith Lutheran Church and their congregation and the money.
Renee, you're frozen.
I think this is going to be the theme for the evening, but we're going to keep trucking on because this is the mighty world of tech that we're in.
And Jean and Ron, if I may just very quickly jump in, may I partly please ask, while I very much appreciate faith-based communities, local organizations, folks are stepping up, equally as much my question part B is the collaboration and assistance from any of our local representatives, if that has been forthcoming or not. I thank you very much.
Okay, so Gina, I don't know if you can jump in on that to answer this question. It's essentially, and please let me know if I'm not getting this correct, that whether or not there's been any assistance here in trying to get assistance forward to our immigrant community from our elected representatives.
Yes, I believe that you're absolutely correct. My question isn't so much if we've reached out to them as organizations, if they've been forthcoming in providing some of that support and assistance. Thank you.
Understood.
Ron, I can actually answer that from HealthNet's perspective.
Okay, so he'll be up next anyway, but yeah, Ian Hedges from HealthNet, please jump right on in, Ian. And then we'll come over to Ellen Joyce's question.
I would actually say that there is a, I think that's a wonderful question. I would say that on both the federal and the state level, representatives have been forthcoming to jump in. One of the things we have seen locally, just through the city governments, is they have provided they have decided, you know what, we are not going to spend money on housing. We're not going to spend money on building new houses. We're actually going to waive our CDBG caps, which is the community development block grants, and give them to public services of people that are currently struggling with COVID-19, which has been really helpful, especially because there's been an uptick in the need for services recently. The other thing that's happened from the state level is that state government officials have really been proactive, and our legislators have also been very proactive at trying to provide opportunities for example, when we provide a service, especially to those in the immigrant community or this new uptick of folks who have recently lost their jobs. But again, we're not making a lot of money off of them. The state has used a lot of the CARES Act funding that was given to the state and provided it to cover some of our losses. And on the federal level, this is specifically to free and charitable clinics, but we are very fortunate, and I do kind of add this to my slide. Any one of HealthNet's patients who's enrolled with us, no matter their immigrant status or anything, can receive COVID-19 testing free of charge. And the way that we, what happened was, from our congressional representatives, is there was put in a provision that said that free and charitable clinics could actually be signed up for a portal, and we go in and type in our client's information, prove that we got a lab result. We obviously will pay for that lab result, but then Optum Insurance will reimburse us for that cost. So it's really $0. So we're encouraging a lot of our patients, if they need to get tested, because it's right now at no cost to us.
So thank you so much, Ian. And there's a question in the chat actually, and about where does the immigrant community go for their health care. What I'm going to do though is I'm gonna have you sort of hold on to that, because I think you essentially answered it, but maybe we can reconfirm it in just a minute when I move to you. I want to get to we have Ellen Joyce with her hand up here. Ellen, go ahead. You're on mute.
I'm sorry. I only do this every day. There is a immigrant task force in Beloit as well as in Janesville. We've been working pretty closely together, especially on the funding issues over the summer to get the word out. There is in fact a fund at St. Thomas Church that is also giving out gas and food cards to immigrants. That group is kind of dormant right now, but if there are Beloit area people who are interested, put your name in the chat or your email or let me know, because I'd love to get more people on my mailing list, if only that. Thank you.
Okay, thank you.
This is Representative Deb Colsty. And
okay.
So I'd just like to reiterate what Ian said about the fact that in this environment that we're in the legislature, where maybe the majority isn't very involved with the immigrant community, that was the CARES Act is meant to supplement, and there's been so many areas that the governor has granted money, and it's meant to supplement for those organizations that are spending money, that they can maybe supplement it with the CARES Act money, as Ian said. So, you know, it's hard in this environment. So, but I hope everybody avails them, you know, when they can fit into the money that the governor's made available. I hope they do that. So thank you.
Thank you very much, Representative. This is great. I didn't realize you were in the audience, so that's terrific. Just in the interest of time, and Ian, I'm glad you were able to jump in earlier because I think it's probably an excellent segue to just sort of head over to you. So our final guest here is Ian Hedges, and so Ian, can you just and you have some slides you're going to show, or?
I think they were sent to you all. I was hoping that they were sent to Amy. Amy, are you able to pull them up?
I sure will.
All right, awesome. Thank you, Amy.
That Amy, I'm unfortunately I'm doing Zoom from my phone, so I can't necessarily share my screen. But one of the things that I really want to go over is I want to kind of talk about a little bit of the assumptions that have gone on in play with COVID-19, some of the disparities that have occurred with COVID-19, and how that's really rooted in a lot of structural racism, share you some of our experiences, and then talk about what HealthNet is doing. Because it really is important that not only are we meeting the healthcare trends of our community, but we're also individualizing our care to meet the needs of person. So I would like to kind of start on my first slide. You know, the obvious question is, does racism play a role in COVID-19? If you could go to the next slide, Amy. And yes, it does play a huge role. one of the things that I keep hearing is, well, this certain group is prone to have more chronic conditions, so of course they are more likely to die from COVID-19, or of course they're more likely to suffer from it more. And the issue with that statement is, while if you look at the data, that might be true, a lot of those things are rooted not necessarily in the behaviors of groups of individuals. And for, they're being put under the microscope for people who honestly only wanted to use this as an excuse now, as opposed to trying to observe it before. But there are a lot of system level issues at play. Many folks who are trying to say it's chronic conditions, they don't realize that these exist because of the social determinants of health that have been neglected in many communities of color. It's old redlining policies. It's pseudo-segregation that still occurs in some physical environments, which cause food deserts, public safety that hinders opportunities to exercise, and to do other things. And as we know, obesity, diabetes, and heart disease are kind of some comorbidities that could cause worse outcomes for people with COVID-19. But another frequent thing that I find very annoying too is that one of the things that has been recently being stated is that the Black Lives Matter protests were attributed to some point of the COVID-19 spikes. And the CDC and many state health departments have actually come out and said that is not true. It's actually what they have attributed to is you are twice as likely to get COVID-19 if you have visited a restaurant or a bar. So it is people's kind of behaviors and neglect for wearing a mask, and not necessarily groups standing up for their rights. Now, if I go to kind of the next slide, one of the things that I really do want to talk about, the disparities. And, some of these are applicable to what we have been talking about, and they're reflective of the county. But individuals who identify as Black, Indigenous, or people of color are more likely to be essential workers. What Ron Nakora said, or Dr. Nakora said before, is absolutely true. Unfortunately, that is who we find to be in these essential roles. And of course, there's lower pay. So there's fewer opportunities for easily getting access to healthcare. But also in COVID-19, there's more opportunities to exposure. One of the things that I am finding too with a lot of essential workers, and anecdotally at HealthNet, is the bird's eye outbreak, that was really reflected in our patient panel somewhat. It wasn't necessarily people who worked at Bird's Eye, but it was family members who were living in a household with somebody who worked at Bird's Eye. And what we were finding, though, in many cases of those individuals, they were still being pressured to go to work. And what frequently happens in the immigrant community, unfortunately, is that they're threatened by bosses, because the bosses informally know that the person might be an undocumented immigrant. And if a person actually says, hey, I am sick, like I can't come into work today, it's been noted several times to us that the boss will say, well, then I'll turn you into immigration. And so again, we're having people in some other jobs coming and they're going to work, possibly exposing their coworkers because of that kind of pressure that's occurring. Another reason too why kind of health disparities exist, and why maybe we're seeing clusters of COVID-19 in certain communities, is because simply segregation, which means more interracial social networking. This has more been heavily documented in other infectious diseases, but about 10 years ago, the CDC kind of came out with a study on HIV/AIDS, which determined that the reason why right now the highest rate of incidence from, among Black gay men wasn't that had anything to deal with certain behaviors or certain assumptions. It was mostly because of segregational policies, because of racism, and folks simply wanting to interact with communities that look like themselves or are reflective of themselves. And so, you know, social networking obviously is a huge, and when I see social networking, I mean like gatherings, you know, that is really, really much more important in terms of whether a disease, I mean, we're obviously seeing that churches, funerals, those are where the spread of the and also medicine has created trust issues with communities of color. I will tell you right now that we have been working with different, we have been working with different community groups, and what we found is that many African-American, Black individuals, also some Hispanic individuals too, have real trust issues with the institution of medicine in general. And it's reflective of hearing the stories of PG trials, clinical trials. It's reflective of also forced sterilizations that occurred in the South. I mean, many people don't realize that tens of thousands of sterilizations occurred amongst Black women in the South. And also just other instances of general discrimination. If you look at the Rock County Health Needs Assessment, there are documented notes in there about people feeling very uncomfortable going to a doctor. One person was having what they thought was a cardiac episode, and the doctor refused to talk to them because they assumed because they were Black, they were uninsured. So unfortunately, this kind of leads to a general health disparity. And when I kind of have now anecdotal reports about what's going on with COVID-19 that are kind of mentioned on my next slide. But, you know, one of the things that have really been happening is we have found that communities were really reluctant to do testing. They were also really reluctant to even come and get some of their conditions treated because, first of all, the shutdown, I think people didn't understand what the shutdown meant. And so we had many of our patients who were undocumented calling us saying, does that mean if I'm like driving my car, am I going to be pulled over? Because, you know, that could definitely lead to a deportation proceeding. And they were also in cases of some testing, I know one of our first community testing, there were police there and many folks did not want to go into that. Now the police had no ill intention of being there. It was probably to direct traffic, but nonetheless, it was still something that felt very traumatic in some ways, and also very much like these communities, that some of the communities felt like they were under the microscope. Another thing that we've really been seeing is a lot of the Latin, and this is, by the way, amongst our clients who belong to these certain groups, and so I hope that this is a story of what's reflected in our patients, not necessarily these groups as a whole. But we are finding that a lot of Latinx families are being dropped or ignored because of language barriers. We actually had somebody come out who had COVID-19. They were dispatched to a house because not only were they had COVID-19, they were also an amputee and they fell, and nobody in their household felt equipped to help because they did not want to catch COVID-19. And so they called the medical professionals, and unfortunately, the medical professionals reached back out to us and said, well, we don't think this is serious at all. And we, you know, we're not trying to just take people to the hospital when they have COVID. And that wasn't like what we were trying to explain to them. It was more like this person kind of had an immediate need. And that's just one documented case that I know of, but there's multiple cases of where that's happening. We've heard of families trying to call about testing and getting hung up on because of that language barrier. There's also just a lot of vaccine mistrust. And again, a lot of that has to deal with roots in medical experimentation in communities of color. You know, because it's being rushed right now, and there's a lot of questions up in the air, that even just fuels the mistrust even more. And we're seeing that a lot with our patients because we are asking them in January or February when we're scheduling appointments or checkups for them. We're saying, if we have the vaccine, would you like it? And we're hearing a lot of no's. So that's kind of unfortunate. If I move on to my next slide, I think the best thing that we can do as kind of nonprofits is, you know, our patient experience builds trust. And so we're very aggressive. We actually have created a dashboard that we hope to be releasing more into the public on our website soon. But we judge our overall performance as an organization by surveying our patients, publishing our results. And one of those measures are the patient's needs being met, and leaving that very general and open. We also are providing very tailored programming in Spanish, but also providing food to match cultural identity for folks who are diabetic, because we want people to kind of carry on healthy lifestyles as well, especially during this pandemic where there are fewer opportunities to get kind of continuity of care. I mean, one of the things that I think is really important, and next slide, is that data and policy and representation are super key. What Nick presented was a really good picture to determine how we should be responding to the pandemic. Those are communities we should be reaching out to and being very much tailored to those needs of that community. Unfortunately, this is not the case in Wisconsin or Rock County. But in some states, there was no racial demographic data collected for COVID-19. Fortunately, it's only 2 states, but nonetheless, it still goes to show you that there is just misguidance about COVID-19 becoming a racial justice issue. And what I would say is disparities in experience and outcomes are very easy to detect in the data. You know, we obviously got that overview from Nick, and we are now looking at that at HealthNet by looking at our quality improvement metrics in determining our health outcomes for our patients and determining what are those outcomes similar amongst other groups? Are they very different? And why is that happening? That's actually what inspired us to start our food box program for the Latinx community to help with diabetes. So the next slide, I just talk a little bit about what HealthNet is doing. I think our organizations need to, again, be mindful of what's going on in these communities and make sure that we are sensitive. But you know, we have hired 5 bilingual staff members, and we have a Spanish option on every single form. We are also kind of having discussion of a Khmer option because of the Cambodian community in Janesville. A diversity policy we've created kind of lays out an affirmative action process for hiring so that we can have people of color as leaders in our management. And we're having a process of preferred bidding on contracts with minority-owned businesses because those are the businesses that really will need empowerment in order to make sure that we are, you know, that everybody is recovering in this new economy that we're facing. And we're in the process of creating a policy on microaggressions for staff, volunteers, because we want to make sure that if somebody has an issue with, you know, a patient says something to them that's hinting at their race or bias, we want to make sure that that our employees or our staff or our volunteers are able to report that in some way. And that is the final slide. And we're just trying to meet clients where they're at. One book I would recommend for people to kind of further understand a little bit about the trust issues in the medical community is called Medical Apartheid. It really is about from colonization to now how medical experimentation has really affected communities of color. And that is about it. I'm happy to take any questions.
All right, thank you so much, Ian. Let me see. Look in the chat and see if we have, we probably have time for just 1 or 2 questions before we head into, we want to have some time to head into the parking lot so that folks can ask their questions more freely without being recorded for posterity, as it were. Let me see, I'm just looking at the chat, seeing if we got anything. We got people thanking you, Ian, for this. This was extremely informative, and I would like to also endorse the book Medical Apartheid. I actually used that book in my classes, one of my health seminars. because I think that it's of course a very powerful book. It's difficult to read. And not difficult because it's written in a very opaque way. It's difficult because the subject matter is very, very emotional in terms of its effect on you as you sort of realize why we have arrived where we have with respect to mistrust with the medical system. Okay, so with that, I don't see any. No, hold on just a second. I think I saw something pop up. Let's see. Oh, okay, right. So, so Gina, we also want to give you the opportunity to answer some questions. So what I'm thinking to do, Gina, if that's all right, is go ahead and move us towards the end. And then Gina, if you and Ian in particular don't mind, well, all of you, in fact, Nick as well, don't mind hanging around for a little bit so that we can get to the parking lot and maybe people can sort of freely ask some questions, if that's all right.
Sounds good.
Okay.
Sounds good, Ron. I would just like to, okay.
All right, go ahead, Jean.
Oh, okay. I'd like to remind everybody that there will be, this has been recorded, this first hour, and Edinburgh Public Library will be placing this on YouTube. So this is the address, the website you can use. And it should be ready by the middle of next week.
Monday it'll be ready.
Okay.
We'll also know that it'll be on the DAT website also. Okay, over to you, Ron.
Okay, so and just make sure, can everyone still hear me? Can you hear me still fine, Jean?
Yes.
Okay, so I thought we'd just like to wrap up with this this quote from the late and honorable Representative John Lewis. When you see something that is not right, not fair, not just, you have to speak up. You have to say something. You have to do something. And those are words. If those aren't words to live by, I don't know what such words are. I mean, this is an individual who saw quite a bit in his life and inspired in ways that I think will be decades really starting to unpack before we realize the impact that he had on our system. So
Yeah.
Thank you all very much. Jean, I'm going to pass right back over to you, and we'll go ahead and wrap up and head to the parking lot.
Okay, sounds good. Ron, I would like to thank you for being the moderator tonight. Nick, your information was extremely valuable. Gina, we were touched by what the Y is doing for the immigrant organization, and we look forward to hearing more about the Immigrant Support Network. That one of the reasons I'm really excited about this group is because it is led by the community. One saw such a need, and they reached out to the Y, to the churches, and Faith Lutheran had reached out to the group. So I'm just really excited about this, and especially as you learn more about their individual situations. Any way we can support our immigrants would be fantastic. I'd like to thank Cameron Mirza and Richard Johnson for helping me plan this program. And I have a couple of events coming up that I think you'll be interested in. Courageous Conversations will be coming up on the fourth Monday, and that's from 5:30 to 7. And that's every month. So if you're interested in that, check out our DAT website. October 15th will be our next program. And I don't know if, Vicki, are you here?
Yes.
Okay. You have 15 seconds.
Okay. So we're going to be close to the election. And so we're going to bring in 2 more people from Beloit College, Kate Johnston from the History Department and Phil Chen from the Political Science Department. And they're going to discuss the many ways voting has been restricted in this country from day one when it was only white men who owned property, to all the restrictions of our current policies, and how voting has been consistently tied to race, class, ethnicity, and gender. And then Lisa Johnson from the League of Women Voters is going to wrap it up by, we're going to be just a couple weeks from the election, and she'll share how and when and where to vote safely.
Okay, good, good. That should be a powerful program. So we invite all of you for that. November 3rd is voting day, election day, so make sure you have your vote count. And November 12th is YWCA Racial Justice Conference. And you can go to the YWCA website to check on that information, Facebook. Okay. And Vicky's program is October 15th, yes. And that again will be advertised through all 6 of our Rock County partners. So thank you. And if you'd like to stay around, we'd love to see your faces. And we will be finished with the parking lot by 8 o'clock. So